My name is Nimi Sherpa, and my project title is Police for Dalits. And the issue that I'll be discussing today is caste discrimination in the Indian police system. Caste discrimination is when you mistreat someone due to their caste, which is an unchangeable hereditary social class in Hinduism that influences how the Hindu society perceives you. In Hinduism, there's a close social hierarchy called the caste system that ranks the 5 Hindu castes in order based on their purity. And as you go down the ranks, the purity and respect associated with each caste decreases, with the lowest one being Dalits, who are also seen as impure and untouchable. And since India is a mostly Hindu country, the caste system is still commonly practiced even though it was outlawed. In India, only 5% of sexual assaults faced by Dalits are registered by the police, while 95% are dismissed. And out of the 5%, 30% of them are stated as false because the offender is often of a high caste. Not only do sexual assaults against Dalits go unregistered, but many police officers refuse to register crimes against Dalits in general. A research by NHRC revealed that out of a random sample of 103 cases against Dalits, only 18 were registered correctly, while the rest were not registered at all. The root cause of caste discrimination is the caste system, which gives privileges to members of the higher caste and oppresses Dalits by waving them off as unimportant due to the idea that Dalits are impure and untouchable. My solution to this issue is to make it mandatory for police officers to take a class about Dalit oppression based in India based on caste. The class will be a month long and it will be taught by a Dalit and will include 3 Dalit guest speakers. The guest speakers will include a child around the age of 8, a middle-aged person, and an elderly. My solution is different because right now India has a downstream solution, which is an unenforced law making it illegal to practice caste discrimination. Whereas my solution is upstream because it targets prevention by educating officers on the oppression of Dalits of all ages due to the caste system. My solution is also innovative because of the incorporation of a child guest speaker. Usually we're taught by adults, but adults are often seen as being able to persuade and manipulate others. So by bringing in a child, I feel that a sense of innocence and honesty will harbor since kids don't often have explicit or implicit biases. And in order to battle caste discrimination in India, in the Indian police force, we must educate the police on Dalit oppression and how their actions can support or prevent it so that we can create a better future with equity for Dalits.
Good afternoon. My name is Kyra Tipton, and my project title is Racism in Healthcare. So it is known that Blacks have a shorter life expectancy than their counterparts due to racial negligence within the healthcare system. Black women today are 3 to 4 times more likely to die of pregnancy or delivery complications than white women, which has been tied to implicit biases or subconscious discrimination in hospitals. This includes ignoring, overlooking Black patients, denying medications, assuming Black patients of having a higher pain tolerance, in addition to forcing Black patients to wait longer for help. Implicit biases as such have led to the mistrust of healthcare systems in the Black community. To solve this issue, instead of only covering slavery in high school courses, ethnic studies should be incorporated as well. Ethnic studies will help others understand the effects of racial disparities and how to correct them. Introducing this to high school students can help eliminate racial beliefs taught in households, thus correcting them before they are brought into occupations within the healthcare system. Though it may be challenging to incorporate ethnic studies to the curriculum, it is important to be taught so the Black community will no longer have to fear the healthcare system, granting a fair opportunity in receiving efficient healthcare as they deserve.
I'm Amanda, and my pronouns are she, her, and they. So my project title is to bring color in STEM, but more specifically in engineering. So I wanted to focus my project on this because I noticed a lack of women of color in the male-dominant field, and I want to increase those numbers. And I'm specifically focusing my target audience to Hispanics, African Americans, and Native Americans, which represents the growing minority demographics and underrepresented population. The National Science Board says that women make up 47% of the current workforce. Of this percentage, however, women of color only comprise of 5%. So a new study from University of Texas at Austin found that Hispanics and Black students leave STEM majors and careers at far higher rates than their white peers. So in order to combat this, I'm proposing a mentorship program aimed to improve the STEM pipeline and include more diversity. It will ideally take place within Mount Diablo Unified School District between the 8th grade and students going into high school. I choose this group because they start to think of careers and majors for college. So having role models and peer groups of the same racial identity gives the students a sense of belonging and builds their confidence. It will also create a concrete foundation and urges them to continue to pursue engineering. The mentors are essentially guiding the students by giving advice from their experience and talking about their journey. The students are introduced to a network of mentors and shadow the mentors in their field. So again, the mentorship program is designed to attract students into pursuing majors and careers in engineering related or in STEM. They can feel more motivated to attend college and go into the workforce, as well as acquire knowledge that is not taught in their classrooms.
Hello, good morning, everyone. My name is Cecilia Subias, and my title project is Women Unite. And did you know that if you are a woman in Contra Costa County, you are not going to get paid the same as your male colleagues? No matter how hard you work or how many degrees you acquire, you still won't be getting paid the same as the men. According to the current data found, women only make 64% of what a man makes a year in Contra Costa. I am a 17-year-old girl going to school for the next 4 to 6 years, and if I decide to join the workforce in Contra Costa, I will be working in one of the counties with the highest pay gap for women. The Contra Costa pay gap is the 4th highest in the state. To combat these depressing statistics, my solution is to create a women's union within large and small companies. The union will enforce policies to help reduce the pay gap by keeping companies accountable for the treatment of their employees. One of the solutions is to have all companies be very transparent with how much they pay each employee, with every bonus, every promotion. They must be documented and shared with the public. And also, it would be a requirement for all of the companies to have a seminar on how to prevent the pay discrimination in the workforce. A website will be developed with input from women in the workforce that will allow information on workers' rights, legal advice, and hotline numbers if a staff needs to talk to anyone about if they feel like they are encouraging pay discrimination at work. This problem has gone on for far too long. Women deserve to be paid the same as their male colleagues. Introducing a women's union in the workforce is a step in the right direction towards equal pay. Not only will we need women to join and support the movement, but men as well, because together change will be made.
Hi, my name is Estrella Yauger, and my project title is Junior Translators. So one of our major problems in our medical field is the connection between the doctors and the patients when there's a language barrier between them. Even though with the translator in the room, it's not as efficient because in most cases, the translator is digital, so through a screen. I personally have been the translator on multiple occasions when taking my parents to the doctors. The problem goes beyond the language barrier. The language barrier is a wake-up call telling us that telling us our line of doctors needs to be more diverse. According to data taken in 2018 by Census, California is made up of 26.9% born foreigners, along with having 44.6% of California residents speaking another language at home as a primary language other than English. What these numbers show us is that California is a country of many colors and that our line of doctors should represent just that. My solution to solve this problem is to have more high school students, such as juniors and seniors, with diverse backgrounds to go under HIPAA training during the time they sign up to volunteer at a hospital. HIPAA is a program that, if not all, most affiliated roles within the medical field have the training. The program of HIPAA teaches the participants how to keep the information of a patient safe and respect their privacy. With the HIPAA training, high school students should be able to have more exposure within their time of volunteering. They would have more exposure because they would go into the room with the doctor and be able to translate what the patient is saying to the doctor, allowing the patient to have a more convenient experience. There would be more interpreters available for them to be able to have a faster connection between them. It would also allow the patient to feel more calm in a sense because they will be able to represent themselves as someone in the room, so that way it's not as tense in the room. It would benefit the high school students because they will get a better exposure to what the medical field is more like, and it would hopefully spark an interest so that way our line of doctors could be more diverse as well. And since the high school students would go under HIPAA training and most translators do get paid, the high school students would get some sort of payment for their time, would get some type of payment for the time volunteering. And my goal is to actually get this program started. So I've actually contacted a couple hospitals, their volunteer manager. Haven't heard anything back. I'm guessing because of COVID, it's really packed, and I'm guessing they're not having any volunteers at the moment. But hopefully within a couple of days, I should get an email back from them and hopefully get this program actually running.
Hi, my name is Daisy Hernandez, and today the issue I'm going to be talking about is lack of affordable housing. I want to keep low-income families in their home and not on the streets, and the lack of affordable housing has led to an increase in homelessness. Currently in Concord, rent increased from 3% to 8% and sometimes even 10%. This affects many low-income families, especially those who are paid minimum wage. Landlords are able to increase rent at a higher rate than the increase in minimum wage. The minimum wage in California is currently $13 per hour and will be $15 in 2022, which is around a 7% per year, which means with my policy of 3%, renters will be able to afford the increase. In a 2019 article in the Mercury News, I learned that in Congress, homeless population jumped from 252 to 300 homeless people in a single year, which was a 40% increase. The target population I am looking to help are low-income families, which primarily include immigrants and people of color. Immigrants may not know English well enough to earn more than minimum wage, causing inequity. Others in this population may not be able to afford a college education or receive training in order to receive a higher income. I am proposing implementing a 3% annually cap on rent increases in Concord. The 3% cap will allow landlords to keep up with increasing expenses in maintaining properties, as well as to protect families from struggling to pay their rent or even worse, become homeless. My policy will work because it will allow low-income families in their homes to enable them to provide for their families. I'm going to make sure my population needs are heard by going to the city council and proposing my ideas to prevent more people from becoming homeless.
Hello, my name is Ruano Hernandez. I'm an upcoming senior at Pinole Valley High School. The concern from my community I'll be discussing is environmental injustice in the Richmond community. Environmental injustice is when a low-income community is being affected by big corporations by exposing toxic waste, pollution, and more. My topic I will be touching on is air pollution in Richmond that is being caused by the Chevron refinery. The data table shows, well, there's a data table that was supposed to show, but yeah, shows the percentages of ethnicities that are living in Richmond. As a result, this population of people of color are being affected by several chronic health illnesses. In the Cal Enviro screen, the asthma percentile for this census tract is 99.88, meaning the asthma rate is higher than 99.88% of the census tract in California. The solution I am proposing is to create a community-informed social justice advocacy group. This specific group will be working with the Bay Area Air District by collecting more data in different areas in Richmond on air pollution and communicating with the community in a transparent way. An executive staff from Groundwork Richmond that I have talked personally has told me that different committees has been taking a reactive approach to collecting data. My solution will be more proactive and collecting more data frequently. We will also involve the community by proposing jobs to help the Air District collect data. This will include having bilingual translators, data collectors. In future steps, we will involve the youth in paid internships and teach them more about data collecting and environmental justice. I hope that with this solution, we as a community may prevent inequity of chronic illnesses from happening to the people of color in Richmond or in the Bay Area.
My name is Anna Henderson, and the title of my presentation is Racism in Healthcare, When Will It End? Although 1/4 of the population of the U.S. population consists of African Americans, Hispanic/Latinos, and American Indians, less than 9% are nurses and 6% are physicians. But at UCSF Health West Bay, over 50% of the staff are people of color. On the other hand, in Oakland, at Benoff Children's Hospital, there are staff that consist of 56%, and those are people of color. My solution to this would be to look more in depth of the hiring process and the job descriptions in order to understand and see what a potential employee needs to be considerable for the position and if gender or race play a key factor or not. By this action, I would hope to see a change in organizations in the sense of more diversity. I feel like the more thriving hospitals are the most diverse because they have people who are there that can make every patient, regardless of their culture or language barrier, feel comfortable with the assurance that they are going to be treated as such.
Hello, my name is Selvin Ayala, and the title of my presentation is Grow. So today I'm addressing the mental health issue at Mount Diablo High School. Most people think that mental health is just about the brain, but it's more than just the physical brain. It deals with our emotions, how we feel, and how we think, which is important because it determines if we're happy or not. It affects the relationships with ourselves and with others. Mental health illnesses include depression, anxiety, but it's not fixed. It's something we can improve in and something we can manage. According to the U.S. Department of Human and Health Services, recovery is possible. Most people with mental health issues can get better. Recovery and treatment is just an ongoing process that takes time. The first step is getting help. Now, how do we help our students? Some students are afraid to speak up, and some students feel like they don't think that they need that, and it's mostly because of the stigma around mental health. People see you in a negative way if you're dealing with mental health illnesses. That brings me to my solution, which is I'm trying to get Mount Diablo staff trained in mental health first aid, which equips the teachers with the tools they need to identify and approach students so they can get them the resources that they need. A teacher sees a student, he shows signs of mental health illness, and she would talk to him and then get him the professional he needs. But it's much more than just the professional. The teacher is better equipped to help the student. The teacher could work things out with the student. The teacher could give the student more space, more time for his health, because this is about health. And the student might not even need the extra time or space, but it's a great option. The student might be doing better than the other students in their class, but this option is great because they need to take care of their health. Anyone can have mental health disorders, and it's okay. People like Michael Phelps, Olympic swimmer, he has a mental health issue. Leonardo DiCaprio, famous actor, he has a health issue. Daniel Radcliffe, the guy from what's it called? The guy from Harry Potter, he has a mental health issue. Adele, she has a mental health issue. Steve Young, 49ers quarterback, he has a mental health issue. So what we're trying to do is we're trying to spread awareness, because by spreading awareness, we get rid of the stigma around mental health. We make Mount Diablo a school that students can count on. We would be making a positive, growing environment so that our students can live a healthier and happier life.
Hi, my name is Graciehla, and my title for my project is Your Body, Your Voice. So in today's presentation, I present to you an idea that I think that would be beneficial, not only to students, but also to help minority groups that this could affect as well, in which is to bring a form of contraceptive that should be brought up is abortion, and which is also involved in the pro-choice movement. This should be accepted as another option for cisgender, non-binary, and trans men if they cannot handle or do not want to bear a child. Most teen pregnancies happen within the minority group in rural areas along with southern state communities because it is not getting brought up and families are at school. Within families, sometimes it is hard to be brought up of the topic of sexual intercourse because of traditional beliefs. And for schools, there's not that much funding due to there being $23 billion less funding for schools that contain more POC. Gender and race-wise, this education could help the Hispanic and Black communities because, as you could see from the data, they are oppressed and more located within those communities because of the redlining, and 77% teen pregnancies are unplanned. Since there is such a big percentage of unwanted pregnancies and many individuals tend to abort a child because people might think it will stop them from their ambitions. And if it was for sexual intercourse, abortion could be a certain way for individuals to not want to remember that by. And educating people is one step closer to opening people's minds about this certain idea of pro-choice. By bringing this up after the contraceptive talk that educators could give and talk about if they want another segment for the students, if they want to learn more about it. And since some schools cannot fund sex ed or a health ban, I want abortion to be acceptable in communities so we could help create less foster homes, because with foster homes, you could see that there's not that much people like being able to take care of kids, and which could lead to child abandonment, housing, and financial issues. This idea can be brought up by trying to talk with like other health organizations such as Planned Parenthood to have this idea heard in low-income communities by teaming up to aid individuals if they cannot afford the cost by doing a campaign with Planned Parenthood, since they already support pro-choice, by making it heard that abortion should be acceptable idea to the educational system. It would be beneficial for both sides. Like, I wanted everyone's voices to be heard and for everyone else in the world to listen, that no one has no say on what you do with your body. So that's why I just want this this type of idea to be brought out for other health organizations as well, to team up with them.